About 8 million people die from premature aging every year according to global studies. It is more than 1 in 5 deaths in some countries. Smoking deaths tend to affect older people more than younger people. The decline of smoking can be accelerated by taxing cigarettes, banning advertising and support to quit smoking. The proportion of adults who smoke is falling in most countries around the world regardless of income level. Men are much more likely than women to smoke. Because most victims are also men and the majority of victims are over 50 years of age, there has been a decline in the number of smokers in most countries in the past 10 years. Influence. Tobacco can be a social activity that serves as a reinforcement of social structures. The sharing of a cigarette is often an important rite of passage or a good excuse to start conversation with strangers, and many smokers begin to smoke in social situations. For young people, it can function as a first step out of their childhood or as a rebellion against the adult world. Smoking can also be seen as a kind of camaraderie. It is doubtless that people who smoke form relationships with other smokers in a way that only perpetuates the habit, especially in countries where smoking is not allowed in public places. The image of the smoker can vary considerably but is often associated with individuality and aloofness, especially in fiction. Even so, the use of both tobacco and cannabis is part of the cultural rituals of many different social and ethnic communities. Modern anti-smoking movements did more than create awareness of the dangers of smoking in the late 19th century. It was and still is perceived by smokers as an assault on personal freedom. In addition to recreational drug use, it can be used to construct identity and develop self-image by associating it with personal experiences related to smoking. Tobacco was recognized early as something that could not be ignored by the commanders. By the 17th century, tobacco was a standard part of the naval diet of many countries. Cigarette manufacturers and governments collaborated in World War I in securing tobacco and cigarette allowances for soldiers in the field. It was asserted that regular use of tobacco would not only calm the soldiers but also allow them to withstand greater hardship. Until the middle of the 20th century, most of the adult population was smokers in many Western countries. Physiology. Drug delivery is very effective if you inhale the gas form of the substance into the lungs. The gas dissolves directly into the pulmonary vein, and then into the heart, and then into a brain, and then affects the user within less than a second of the first inhalation. This is due to being similar to naturally occurring substances such as endorphins and dopamine, which are associated with pleasure sensations. The results are usually referred to as a high that ranges from the mild stimulus caused by nicotine to the intense euphoria caused by heroin and cocaine. The sulfate derivative is most commonly inhaled through the nose, though pure forms of the drug can sometimes require considerable skill in administering the drug properly. In addition, the method is somewhat inefficient because not all of the smoke will be inhaled. Overall health and cancer risk. Smoking can damage the organs in your body and affect your overall health. As an environmental risk factor, smoking is associated with conditions such as rheumatoid arthritis. The link between smoking and many types of cancer has also been well studied. With a quit smoking habit, the risk of developing many of these types of cancer decreases in about 10 to 20 years depending on the type of cancer. The risk is still higher than for people who have never smoked. Vision. Smoking can affect your vision and the optic nerve. In some cases, it may cause you to develop eye conditions. These may include glaucoma, which puts pressure on the retina. Sighted cats can cause macular degeneration and cloudy vision. This can cause damage to a spot in the center of your retina and can cause loss of central vision. Lung damage. Smoking can cause a cough. Is it possible to worsen asthma? It can also make you more susceptible to certain infections that affect the lungs like tuberculosis and pneumonia and increase the possibility of death from these illnesses. In addition, inhaled cigarettes cause lung damage and tissue loss that never recovers. Children. If the pregnant person smokes during pregnancy, babies can be born with underdeveloped lungs. Smokers can end up with smaller and weaker lungs than those of non-smoking teenagers. Children whose parents or caregivers who smoke cigarettes may also experience certain health conditions at a higher rate than children whose parents or caregivers do not smoke. Smoking can increase the risk of skin cancer, especially squamous cell carcinoma. Tobacco smoke can affect the structure of your skin. This may contribute to premature skin damage as a result of age. It can also lead to skin diseases such as psoriasis and skin cancer. Type 2 diabetes. Smoking also has an effect on insulin, making it more likely to develop insulin resistance. People who smoke cigarettes have a 30 to 40% greater risk of developing type 2 diabetes and its complications. Type 2 diabetes tends to develop faster in people who smoke than people who don't, as it may be harder to control. Skeletal system. It is related to developing conditions like osteoporosis or bone fractures. Smoking can also have a negative impact on bone healing if you have a fracture. In females, smoking may cause the menopause to occur earlier in life. The menopause accelerates the bone loss process. In addition, smoking can cause tooth decay. Smoking can affect your bone health by reducing your bone density and thereby contributing to bone loss. Central nervous system. Nicotine hits your brain in seconds and can keep you energized for a while. But as the effect fades, you may feel tired and crave more. It can impair your ability to think and cause you to feel bad emotions. These may include depression. Withdrawal can also cause headaches and sleep problems. Periodontal disease. Using tobacco can increase your risk of periodontal disease or gum disease. This happens because smoking causes inflammation around the teeth and gums. The gums may become swollen and bleed, and eventually begin to pull away from the teeth. How can a disease caused by smoking be treated? In most cases, smoking can be controlled by a healthcare provider. Depending on the damage to your heart, you may need a cardiologist. A lung specialist is able to treat breathing problems. An oncologist is a team of doctors that can treat any cancer you may have. How can I quit smoking? To succeed, you have to find a smoking cessation plan that works for you. Get rid of cigarettes and anything related to smoking. When the cravings hit, don't focus on them. It is temporary, so focus on why you want to quit rather than what you want. If you want to hang out with non-smokers, go to places that don't allow smoking. Don't substitute food or sweets for tobacco. These may cause weight gain. You should instead choose low-calorie, healthy foods. There's also the possibility of meditation to reduce your stress levels. You have to be ready mentally and emotionally for yourself and not just for your family or friends exposed to secondhand smoke. You should quit smoking. Give yourself a deep breath when you feel the urge to smoke. Keep it for 10 seconds and release it slowly. Repeat this several times until the urge is gone. If you are concerned about your health, talk to your doctor about a plan to quit smoking. Remind yourself that you're a non-smoker and you don't smoke. Always exercise because it has health benefits and can help you relax and recharge. Thank you for watching. Do subscribe, like, and share.